This case is a great reminder that the most dangerous part of treatment sometimes isn't always the disease, it can actually be the recovery. So here we have a 14-year-old cat that presented after about 4 weeks of diarrhea and having a chronically decreased appetite. On exam, you notice that she looks visibly jaundiced. So you collect blood for a CBC and a chemistry evaluation. Her blood work here shows that she has a normal hematocrit of 36%, but she has a mild hypoalbuminemia and a markedly elevated ALP. But what's interesting here is that she has a normal GGT. And then finally, she has a very high total bilirubin. You recognize this lab pattern in cats as a classic red flag for hepatic lipidosis. The reason why is that cats have a limited enzyme induction for ALP, and so when ALP is elevated, it usually reflects a primary liver disease rather than just upregulation from stress steroids. Also, because hepatic lipidosis primarily affects hepatocytes, it causes them to swell with lipid accumulation. It does not affect bile duct cells, so ALP will rise while GGT, which is more of a bile duct associated enzyme, won't rise as much. Other primary liver diseases in cats are things like cholangitis, cholangiohepatitis, and extrahepatic bile duct obstruction. But in these cases, cats will generally have a high ALP as well as a high GGT. Hepatic lipidosis was confirmed with an abdominal ultrasound and a liver needle biopsy. She was also hospitalized and an E-tube was placed. And that allowed you to start a regimen of food. And so 1/3 of her resting energy requirement was started. And this was gradually increased over 3 days to allow you to give her the full resting energy requirement. The other treatments that were started were mirtazapine for appetite support and also vitamin K once a day as a sub-Q injection because you know that the liver, when it's sick, can't recycle vitamin K. And so you gave vitamin K, and then the last supplement you gave as well was Adenosol as a liver antioxidant. With these treatments, she seemed to be doing really, really well, so you eventually sent her home. But unfortunately, within 2 days, she seemed to get a lot worse, and she came back to you in worse shape. You repeated her blood work, and her new blood work showed an alarming drop in her hematocrit. It was down to 17%. Her albumin also had dropped further, and now she had other electrolyte abnormalities, which included a low phosphorus and potassium. Her bilirubin now had also doubled. What do you think of the anemia? Generally, when we're thinking about anemia, there's 3 main buckets. There's increased destruction, there is decreased production, or there's actually blood loss happening. Now, in this case, you do see that it's going to be too early to tell if it's regenerative because it's been less than 3 days since the anemia occurred. This is very acute. There is the possibility of blood loss because there's a low albumin now. But her bilirubin has nearly doubled, and this suggests that there could actually be hemolysis. She did come in with jaundice from her liver disease, but red cell lysis could be a contributing factor, so you want to look at a blood smear. And this is your blood smear. Your blood smear here reveals numerous Heinz bodies, these little guys, and they're highlighted well with this new methylene blue staining. Finding Heinz bodies tells you that there's an oxidative injury happening to red blood cells, and this typically causes red cell lysis and anemia. This constellation of findings, acute hypophosphatemia, worsening anemia, and Heinz bodies, also with a recent reintroduction of calories, is classic for refeeding syndrome. One study of cats with refeeding syndrome showed that over 50% of these cats actually had hepatic lipidosis, and this syndrome typically happens within 2 to 5 days of starting food. How refeeding syndrome works is that your total body stores of potassium, phosphorus, and magnesium are depleted due to starvation and chronically low insulin. Too much food given too quickly will surge the insulin, and that will drive potassium intracellularly. Phosphate is also consumed for ATP production and for glucose metabolism. Now, phosphorus is critical for ATP production and red blood cell membrane stability. And when serum phosphorus drops, the red blood cell membranes become fragile and makes them much more susceptible to oxidative damage. And this is why you see Heinz bodies and hemolytic anemia. How do you avoid refeeding syndrome? The key is that nutrition needs to be reintroduced more slowly. A general guideline is to start low and gradually increase towards full resting energy requirements over at least 4 to 5 days. In this case, transitioning too quickly over 3 days likely contributed. So, if you're managing a malnourished cat, especially one with hepatic lipidosis, pay close attention to their lab work and monitor not only their liver values, but also watch phosphorus, potassium, and the red blood cells.